Hello and welcome. In health and social care, establishing consent is crucial. It respects individual rights and ensures ethical practice. Let's explore the importance and methods of obtaining consent in these settings. Consent means an individual gives permission for something to happen. In healthcare, it must be obtained before any treatment or support. It shows respect for autonomy. Consent can be informed, verbal, written, or implied. Each type ensures the individual's understanding and agreement. Consent protects individual rights and autonomy. It ensures legal and ethical practice, preventing assault or negligence. Building trust is key, as it encourages cooperation. Person-centered care aligns with individual preferences through consent. It also protects practitioners from legal claims. Consent is needed for medical treatments from minor to major procedures. Personal care activities like dressing or eating also require consent. Medication administration must be agreed upon unless legally ordered. Sharing personal information requires consent, except in safeguarding cases. Participation in activities and recordings also need consent. Cognitive ability and mental capacity influence consent capability. Age and legal status affect understanding and decision-making. Communication barriers can hinder consent, requiring aides or interpreters. Emotional state and stress levels may reduce decision-making ability. Substances like drugs or alcohol can impair consent validity. Cultural norms may involve family in decisions affecting consent. Social pressures can impact an individual's freedom to consent. Access to clear information is crucial for informed consent. Staff should use plain language and visuals to aid understanding. Ensuring understanding prevents consent from being uninformed. Establishing consent involves ensuring agreement is informed and voluntary. Clear information about the action or activity is essential. Checking understanding ensures the individual is not under pressure. Consent can be verbal, written, or implied. Respect for refusal and continuous review is important. Provide clear information about the activity and its risks. Check understanding by asking individuals to repeat information. Gain agreement in an appropriate form, be it verbal or written. Respect refusals and review consent regularly. Documenting consent is crucial for legal protection. Consent may be hard to obtain if the individual is confused or in pain. Communication barriers may prevent understanding. Family or advocates can help clarify wishes. Assessing mental capacity is vital in decision-making. In emergencies, acting in the person's best interests is necessary. Language differences can hinder consent. Speech impairments or hearing difficulties may prevent understanding. Interpreters or assistive technology can aid communication. Visual aids or demonstrations may clarify information. Overcoming barriers ensures informed consent is possible. Family or advocates can support decision-making when consent is difficult. They help clarify the individual's preferences and choices. This is crucial for those with limited communication skills. Their involvement ensures decisions align with the individual's wishes. Family input respects cultural norms and personal preferences. The Mental Capacity Act guides capacity assessment. Assume capacity unless proven otherwise. Support individuals in making decisions where possible. Best interest decisions are made if capacity is lacking. Least restrictive options should always be chosen. In emergencies, care may proceed without consent to protect life. Actions must be justified and recorded afterwards. The priority is to prevent serious harm. Consent should be sought as soon as possible after the emergency. Documentation of actions maintains legal and ethical standards. Recording consent protects both the individual and practitioner. Written records are vital for medical treatments. Documentation ensures procedures were followed correctly. It provides evidence of the individual's agreement. This is essential for legal and professional accountability. Consent is not a one-time event. Regular checks ensure it remains valid. Changes in condition or preferences may affect consent. Individuals have the right to withdraw consent at any time. Continuous review respects autonomy and preferences. The Mental Capacity Act provides guidelines for consent. It outlines procedures for assessing capacity. Legal frameworks ensure ethical practice. They protect both individuals and practitioners. Understanding these laws is crucial for compliant care. Consent is a cornerstone of ethical care. It respects the individual's rights and dignity. Ethical practice involves informed and voluntary consent. Practitioners must balance duty of care with respect for autonomy. Ensuring consent aligns with ethical principles in care. Consent is central to person-centered care. It ensures care aligns with individual preferences. Avoiding a one-size-fits-all approach respects uniqueness. Consent empowers individuals and upholds their rights. Person-centered care values choice and independence. Asking for consent builds trust with service users. It shows respect and makes individuals feel valued. Trust encourages cooperation and reduces resistance. Clear communication is key to building trust. Consent processes enhance positive relationships in care. Documenting consent protects practitioners legally. It shows that proper procedures were followed. Consent forms provide evidence of agreement. This protection is vital against legal claims. Practitioners must ensure consent is documented accurately. In conclusion, we have learned that consent is vital in health and social care. It safeguards rights, ensures ethical practice, and builds trust. Understanding and establishing consent is essential to protecting both individuals and practitioners. Thank you for watching this video. If you have any questions, please feel free to contact us via WhatsApp at 0748 436 1688.